this is Marlita Castillo. In this presentation, I will explain the theoretical model that I selected and show how this concept can be applied to my CSP or Healthy People 2020. I can use the health belief model as a theoretical framework for my DNP project. The health belief model is a conceptual framework in psychology that examines how people's beliefs and perceptions affect their actions with regards to their health. I can apply HBM to investigate how patients' beliefs perceptions about the efficacy of dignity therapy may affect their willingness to participate in this intervention in the context of my project on dignity therapy and the reduction of psychosocial distress among terminally ill patients and Healthy People 2020. Additionally, I can determine whether patient participation and decrease of psychological distress are impacted by healthcare patients' participation, and the decrease of psychological distress are impacted by healthcare professions' communications about dignity therapy, and whether this furthers Healthy People 2020's overarching objectives. In the 1950s, the social psychologists Hobsbawm, Rosenstock, and Kegels created the health belief model, a psychological theory based on people's thoughts and ideas. It aims to comprehend the action to safeguard and improve their health if they think about crucial aspects. First, perceived susceptibility. People must think that they are vulnerable to specific illness or issue. In this project, people with terminal illness must believe they are vulnerable to mental suffering. Second is perceived severity. Individuals must consider their health problem to be severe and capable of having serious negative effects. Patients who are terminally ill, sick, should be treated with extreme caution because of psychosocial suffering. Third, benefits that people perceive. The fourth one is perceived barriers. And the fifth one is cues to action. The following strategies would be used to implement the health benefits model in order to explicitly address the health issue of lowering the psychological distress among terminally ill patients using dignity therapy within the context of Healthy People 2020. First, evaluating patient perceptions and beliefs. Second, identify beliefs, benefits, and barriers. Third is develop specific communication techniques. The fourth is give instructions and prompt for action. And the fifth is increasing self-efficacy. Sixth is watch and assess. And the seventh is modify intervention. The fifth one is increasing self-efficacy, that provides resources and support to help patients gain self-assurance in their capacity to participate in dignity therapy. Offer advice, instruction on how to communicate effectively while addressing delicate end-of-life issues. The sixth is watch and assess, constantly evaluate patient perception of psychosocial distress as well as attributes and behaviors related to dignity therapy. Analyze how well patients engage in dignity therapy as a result of healthcare professional communication tactics. The seventh is modify your intervention. Adjust communication tactics and intervention as needed in light of continuing evaluation and feedback. Ensure that the healthcare professional continue to respond to patients' evolving views and beliefs. It is possible to learn more about how patients' beliefs perception affect their willingness to engage in dignity therapy by methodologically applying the health belief model in this way. This method enables you to create and implement particular communication strategies that are in line with patients' individual needs, goals, and thereby improving the decrease of psychological distress among terminally ill patients in line with Healthy People 2020 goals. Thank you so much for listening, and these are my references.